Hey, what's up guys? This is EG. Good morning. Today we're going to be discussing about peptic ulcer disease. Peptic ulcer disease occurs when stomach acid damages the protective lining of your stomach and duodenal regions. So any portion of the GI tract that comes into contact with gastric secretions is susceptible to ulcer development, which can lead to either acute or chronic ulcers in the gastric or duodenal regions, depending on the severity. The main causes and risk factors of peptic ulcer disease are H. pylori infection, which causes 80 to 90% of incidences. The H. pylori bacteria produces urease, which activates the inflammatory response that leads to the release of more gastric acid in the stomach. Other risk factors include NSAIDs, alcohol, smoking, and coffee, all of which promote gastric irritation and the release of gastric acid in the stomach. So when hydrochloric acid seeps back into the compromised stomach lining, it damages cells and triggers an inflammatory response, leading to the release of histamine, which results in vasodilation and increased capillary permeability. With the activation of inflammatory response, it releases more gastric acid in the stomach and duodenal regions. As more acid erodes the stomach lining, ulceration develops. So there are three major emergency complications of PUD: GI bleeding, perforation, and gastric outlet obstruction. GI bleeding from worsening ulceration in the stomach is probably the most common complication. So when a patient is actively bleeding from gastric ulcer, it lowers their H&H, their hemoglobin hematocrit, and blood pressure. Perforation can also result in spilling of gastric contents into their peritoneal cavity, which leads to bacterial peritonitis. Perforation can lead to sepsis and eventually septic shock. And then, of course, gastric outlet obstruction occurs due to edema, inflammation, spasm in the pyloric sphincter, and fibrous scar tissue resulting from ulcer formation. Now, the main treatment if the patient develops obstruction is to decompress the stomach by placing a nasogastric tube or NG tube, which also helps with pain. When we talk about clinical manifestations, the patient usually complains of upper abdominal pain or epigastric pain, especially 1 to 2 hours after eating food. Now, some patients may experience back pain, feeling of fullness, bloating, and nausea and vomiting. So one of the diagnostic tests we use to rule out peptic ulcer disease is endoscopy to identify the location of the ulcer. With endoscopy, we can also do a biopsy and collect specimens to check for the presence of H. pylori and rule out cancer. Other studies like barium swallow test can also be performed to rule out gastric outlet obstruction. We can also collect stool samples to rule out H. pylori infection and check their complete blood count, including hemoglobin and hematocrit, to rule out bleeding and anemia. Now let's discuss the nursing management. A patient who develops acute and severe upper abdominal pain or complications should be kept NPO and have a nasogastric tube placed. If the patient's hemoglobin and hematocrit levels drop and GI bleeding is suspected, then your patient may need a blood transfusion. We can also administer IV fluid to hydrate the patient and maintain normal blood pressure. If we suspect infection from H. pylori bacteria, we can start with an antibiotic like amoxicillin. If your patient is allergic to penicillin, then we can switch to metronidazole. To reduce gastric secretion, we can prescribe proton pump inhibitors and H2 receptor blockers. These medications can also help with ulcer healing. Sulcarfate is a cytoprotective drug that forms a protective layer over stomach and duodenal ulcers against any acids that come into contact with them. Educate your patient to avoid foods and fluids that can cause gastric secretions such as spicy foods, pepper, and alcohol. Also, encourage your patient to avoid raw and uncooked food and wash their hands with soap when preparing food to prevent H. pylori infection. Lastly, educate your patient to consult their doctor or go to the emergency department if they develop any worsening epigastric pain, GI bleeding, and low blood pressure.